The superficial brain injury and bleeding can be explained by the coup and counter-coup mechanisms and also by the tearing of the bridging veins. A direct compression on the skull will hurt the underlying brain by a contusion. This is called the coup injury. Whereas when the brain moves after the primary impact and lags behind and hits the opposite side, there is a contusion there which explains the indirect impact or the counter-coup injury. The brain being loosely connected to the cranium via the bridging veins, these veins tear when the brain lags behind any injury, and this causes a subdural hemorrhage. The injury of the deep structures of the brain are explained by the wave propagation theory, stating that the concave surface of the cranium transmits the waves deep into the brain. Also by the shear strain mechanism in the layers of the brain, either in the layers of the cortex or between the brainstem and the brain itself. This disrupts the reticular activating system, and this leads to a progressive phenomenon finally ending up in diffuse axonal injury. Initially there is a focal axonal alteration which increases the calcium permeability, activating the proteases, and finally this leads to a disconnection. A compressive strain caused by a motor vehicle accident on the mid-third of the face is worse for the people sitting in the front as opposed to people sitting in the back seat. As far as thoracic injury is concerned, it depends upon the rate and the degree of impact. The heart can be compressed to half its pre-crash diameter, and the pressure in the chambers increases to twice the normal due to the rapid distortion of the injury. Regarding the fixed and mobile structures in the chest, a vertical shear causes a strain at the root of the ascending aorta, whereas the horizontal injury causes a strain at the ligamentum arteriosum, thereby either partially or completely transecting the descending aorta. The major bronchus, which is 2 cm away from the fixed carina and trachea, is the most common part where the injury occurs either in vertical or horizontal strain. The solid and hollow viscera of the peritoneum or the abdominal cavity also have fixed and mobile portions. At the porta hepatis, the splenic ligaments and its hilum, the pancreas between the head and the neck, the kidney, its ligaments and its hilum. These are the junctions of the fixed and mobile part of the solid viscera. Whereas the hollow viscera, for example the attachments of the transverse colon to the ascending and descending, the iliocecal junction, and the mesosigmoid and ligament of Treitz are where most common injuries are seen. Regarding overcompression and overburst phenomenon, the solid viscera like the kidneys, the spleen and the liver get lacerated when too much of pressure is applied on them. The same thing even happens to the abdomen as a whole when we consider that there is too much of pressure on the abdomen. The part which offers least resistance is the left hemidiaphragm. Therefore, left hemidiaphragmatic injuries are 3 times more common than the right diaphragmatic injuries. At times there is even a pseudo-obstruction of the bowel, wherein a loop of bowel is caught up between 2 areas due to an overpressure and there is a burst, commonly seen around 30 cm distal to the ligament of Treitz. Regarding musculoskeletal injuries, the most common things seen on the X-rays or CT scans are fractures, but one should remember that during a fracture, so much of force is applied and the impact is taken by the soft tissues and the neurovascular bundles, which explains why there is so much of muscle contusion and neurovascular injury. The rate of patients who are taken to the operating room are 5:1 if you compare orthopedics to any other specialty. Post-operative, the patients need extensive physiotherapy, and a significant percentage of patients have permanent injury. When there is a high impact injury, there is also injury to the soft tissues and the neurovascular bundle in addition to the bones, whereas the low impact injury can cause crush injuries and avulsions. Regarding the head and the neck, because the head is quite heavy and it has to be supported by lighter bones and muscles and ligaments, the whiplash injury, which is caused by hyperflexion followed by hyperextension or hyperextension followed by hyperflexion, puts a tremendous strain on the musculo-ligamentous structures. In addition to that, when there is a hyperextension injury, there is injury to the facets. Whereas when there is a hyperflexion injury, there is a fracture dislocation of the vertebra. In pediatrics, if one would compare to the adults, the same type of injuries will cause lesser mortality in pediatrics, whereas the same mechanism of injury will cause higher mortality in pediatrics. In pediatrics, the bones, ligaments are quite lax and compliant. Therefore, there could be a displacement of the bones and ligaments and then a realignment. Thus, when an X-ray is taken or when a CT scan is done, everything looks absolutely normal, but there could be tremendous injury to the nerves and the vessels. Obese children fare worse because there is more amount of weight and inertia as opposed to the amount of muscle mass which can support them. The most commonest cause of fetal death in the pregnant population is abruption of the placenta. The geriatric population have 5 to 10 times higher mortality than the adults. This is explained because of the low bone density, the poor musculature and the poor ligaments, and usually they never return to the previous level of independence after injuries. As far as the blast wave is concerned, the primary injury of the blast wave is caused because of the wave itself, that is the positive and the negative wave. The secondary injuries are caused because of the bomb fragments or because of the shrapnel from the environment. The tertiary injuries are caused because of acceleration and deceleration of the body on different objects. The quaternary injury is caused because of the heat and the toxins. And the quaternary injury is caused as a long-term effect from the bacteria, the radiation causing radio decay, and the environmental contaminants. The take-home message is that inertia of rest or motion can cause injuries to the brain and fixed and mobile structures in the chest and the abdomen. The overburst and compression phenomenon causes injuries to the solid and hollow viscera and also injuries to the left hemidiaphragm. Think not only of fractures in musculoskeletal injuries but also injuries to the neurovascular bundle and the soft tissues. In the pediatric population have a very high index of suspicion because they are lesser external injuries. In pregnant population, an ultrasound should rule out abruption of the placenta. In the geriatric population, one should be a little careful because mortality is 5 times higher. And finally, remember that during any explosion, there are 5 different mechanisms by which the